This semester, we will be concentrating our study of pathology to the head and neck area. However, there are certain terms and processes that we covered in DH 366 that are applicable to DH 367. So we will start with a review of terms. Disease is a structural or functional change within the body judged to be abnormal. And pathogenesis, a sequence of events that leads to abnormalities. With certain diseases, we will be looking at the pathogenesis, the sequence of events that leads to such abnormalities, as well as the appearance and the causation of those abnormalities. A symptom is evidence of disease as presented by the patient. So it is what the patient tells you. A sign is a physical observation by the clinician or examiner. So this is something that you would see when you examine the patient. Pathology is the study of disease. It's also the analysis of blood, body fluids, and tissues for diagnostic purposes. Etiology is the science and study of causes of disease and their mode of operation. In other words, the science of cause and causality. We can distinguish pathogenesis from etiology in the following way. While pathogenesis is the events that lead to disease, etiology looks for the cause that started the pathogenesis of a disease. For example, cigarette smoke may be the cause of squamous cell carcinoma, but its pathogenesis begins with changes, dysplasia in the epithelium. A lesion is a pathologic or structural change in tissue. Inflammation is a non-specific reaction of tissue to injury. It is the body's protective response initiated so the organism can survive, and as we said before, is denoted by ITIS. While we always consider inflammation to be sort of the enemy when we are looking in the oral cavity, please be aware that if we did not have the inflammatory process, we probably would not have lived past a few days after we were born. Infections and bacteremia are of particular interest to us because many oral lesions are indeed infections. In everyday practice, we as dental hygienists frequently cause bacteremias when we scale. So infection we can consider to be sort of a subset of inflammation. And last semester we talked about opportunistic, which are infections that take advantage of a weak immune system, and zoonotic. And we are now living through what we would consider to be a zoonotic infection because the coronavirus is believed to have jumped from animals to humans. The 5 signs of inflammation have followed us into Dental Hygiene 367. They are rubor, which is redness, which comes from the dilation of blood vessels and increased blood at the injury site. Tumor, which means swelling, which is increased fluid in the cells of the intercellular space. Calor, which is heat. This is due to the increased blood and increased cellular levels of activity at the site of inflammation. Dolor is pain. This is due to the compression of nerve fibers, accumulated fluids, and the release of pain-producing chemicals. The final sign of inflammation is loss of function. While a broken arm is the most obvious manifestation of this 5th sign, several oral inflammations can hinder the function of the oral cavity. We need to remember what happens when tissue is destroyed or injured. In most cases, the damaged tissue is restored by replacement, which means that new tissue is not functional. Few tissues regenerate, bone for instance. As we saw last semester, if essential tissues are simply replaced, the consequences can be fatal. Some of the cell and tissue changes that we will also see this semester are hyperplasia, hypertrophy, and atrophy. So please be aware of the distinction between hyperplasia and hypertrophy. Hyperplasia is an increase in number of cells, and hypertrophy is an increase of number of the size of the cells. And atrophy is the decrease in the size of the cells, organs, tissues, or body parts. Some cell changes are irreversible, such as ischemia. And ischemia means restriction of blood flow. An infarct is the site of damage, dysfunction, or death of tissue where the blood supply has been blocked. Other irreversible cell changes are necrosis, which is the death of cells and tissues, and apoptosis, which is programmed or planned cell death. The characteristics of neoplasms remain the same. The location of a benign or malignant lesion does not change the basic characteristics of each of these lesions. So this concludes our brief introduction and review to oral pathology. If you have questions or issues or things that you do not understand, please do not hesitate to let me know.